Did you know that heart disease kills more people than any other disease worldwide? Many don't realize how much their diet impacts heart health, especially when keeping arteries clear. When arteries are blocked or unhealthy, blood flow to the heart is restricted, leading to high blood pressure, chest pain, and even heart attacks. But here's the good news: certain foods, especially vegetables, may naturally help keep your arteries clean and reduce these risks. In this video, we'll tell you about 10 powerful vegetables that have been proven to support artery health. These everyday veggies contain special nutrients that help lower cholesterol, reduce inflammation, and keep blood flowing smoothly. So stay tuned to find 5 vegetables that may damage your heart health. Remember, while diet plays a big role in heart health, always consult a healthcare professional before making major dietary changes. Now, let's start the video. 1. Garlic. When you eat garlic, especially fresh or lightly cooked, it releases allicin, a sulfur compound that's responsible for its strong smell and health benefits. Allicin works in a fascinating way to reduce blood pressure, which eases the strain on your heart and arteries. It relaxes the blood vessels, helping them expand so that blood flows more freely. This reduces the risk of blockages that could lead to a heart attack. Allicin also helps lower LDL cholesterol, the bad cholesterol that may build up as plaque on artery walls. Over time, keeping LDL levels low may make a huge difference in keeping your arteries clear and healthy. Apart from that, there is another element that makes garlic powerful for your heart: its antioxidants. These compounds protect your cells from damage caused by free radicals, unstable molecules that may lead to inflammation and oxidative stress, both major contributors to artery damage. By reducing oxidative stress, garlic's antioxidants help prevent the hardening of arteries, a condition known as atherosclerosis, which is a primary risk factor for heart attacks. According to a study by AHA journals involving 1,226 women aged 70 and older, a higher intake of allium vegetables like garlic lowered the risk of death related to atherosclerosis. Most experts recommend eating 1 to 2 cloves of fresh garlic a day to get these heart benefits. But keep in mind that garlic may cause digestive discomfort for some people and may thin the blood. 2. Spinach and kale. Spinach and kale are 2 leafy greens that do wonders for your heart, helping to keep your arteries clear and lower your risk of heart attack. These greens are packed with nitrates. When you eat nitrate-rich foods like spinach and kale, your body converts these nitrates into nitric oxide, a molecule that relaxes and widens blood vessels. This process helps improve blood flow and lowers blood pressure, both essential for heart health. With lower blood pressure, your heart doesn't have to work as hard to pump blood, reducing strain on your arteries and decreasing the risk of damage and plaque buildup over time. This widening effect on blood vessels also makes it easier for blood to move smoothly, preventing blockages that could lead to a heart attack. Next is vitamin K, which is crucial for heart health but often overlooked. Vitamin K helps regulate calcium levels in the body, ensuring calcium is directed to your bones rather than building up in your arteries. When calcium accumulates in arteries, it may cause stiffness and calcification, increasing your risk of heart disease. By keeping calcium out of your arteries, vitamin K helps maintain their flexibility, supporting a healthy blood flow. This is essential because stiff arteries are more prone to damage and may make it harder for your heart to pump efficiently. According to the American Heart Association, 1 serving of green leafy vegetable consumption daily lowers the risk of cardiovascular disease, coronary heart disease, and stroke by up to 18%. For the best heart benefits, try to include 1 to 2 servings of leafy greens like spinach or kale each day. A serving is roughly 1 cup of raw or half a cup of cooked greens. However, if you're taking blood-thinning medication, it's essential to talk to your healthcare provider before increasing your intake of vitamin K-rich foods, as they may affect how the medication works. 3. Broccoli. Broccoli is high in dietary fiber, which plays a crucial role in controlling cholesterol levels. When you eat fiber, it binds to cholesterol particles in the digestive system and helps remove them from your body. This process lowers the levels of LDL cholesterol, the bad cholesterol, in your blood, which is key because too much LDL may lead to plaque buildup in your arteries. Over time, as LDL cholesterol accumulates, it hardens and narrows the arteries, increasing the risk of a heart attack. So by eating broccoli regularly, you're helping to keep those cholesterol levels down, which means smoother, clearer blood flow. Another unique compound in broccoli is sulforaphane, a potent antioxidant and anti-inflammatory agent. Sulforaphane helps activate certain enzymes in your body that work to protect artery walls from damage and inflammation, two major factors that lead to plaque buildup. Inflammation is a root cause of many heart issues as it may weaken blood vessels and allow plaque to stick more easily to artery walls. By reducing inflammation, sulforaphane essentially cleans and protects your arteries, keeping them flexible and resilient. A Springer review highlights that sulforaphane from green veggies like broccoli may counter vascular inflammation. For maximum heart health benefits, try to include 1 to 2 servings of broccoli in your meals each day. Just be mindful that eating large quantities of cruciferous vegetables like broccoli may cause bloating in some people, so balance it out with other veggies if needed. 4. Asparagus. Asparagus is a rich source of folate, a B vitamin that plays a crucial role in reducing levels of homocysteine, an amino acid in the blood. High levels of homocysteine are associated with a greater risk of artery damage, which may lead to plaque buildup and, over time, increase the risk of heart attack and stroke. Folate works by helping break down homocysteine, keeping its levels in check and protecting the walls of your arteries from damage. By lowering homocysteine levels, folate from asparagus actively reduces one of the lesser-known but impactful risks to your heart health. A PubMed review notes that folate deficiency, common in the elderly, smokers, alcoholics, and oral contraceptive users, raises homocysteine levels, a risk factor for cardiovascular disease. Studies suggest that supplementing with folate may help lower this cardiovascular risk. Including about a half cup to a full cup of asparagus in your meals several times a week is a good target to get these benefits. However, keep in mind that asparagus has a natural diuretic effect, which may lead to increased urination. 5. Tomatoes. Tomatoes contain lycopene, a powerful antioxidant that gives tomatoes their bright red color. Lycopene is known for its ability to reduce the oxidation of LDL, or bad cholesterol, in the blood. When LDL cholesterol oxidizes, it becomes more likely to stick to the walls of your arteries, leading to plaque buildup over time. This plaque may narrow the arteries, restrict blood flow, and increase the risk of heart attack. Lycopene helps prevent this oxidation, keeping LDL levels low and your arteries clear. Some studies even suggest that lycopene may improve the flexibility of blood vessels, allowing for better blood flow and reduced blood pressure. A Carger review suggests that lycopene from tomatoes may lower cholesterol, reducing atherosclerosis risk. The second heart-protecting nutrient in tomatoes is potassium. Potassium is crucial for regulating blood pressure because it helps balance sodium levels in the body. High sodium levels are linked to high blood pressure, which may strain the arteries and make them more vulnerable to damage and plaque buildup. By promoting a healthier sodium-potassium balance, tomatoes help lower blood pressure, easing the stress on your heart and arteries and reducing the risk of cardiovascular issues. For heart health, try to eat at least 1 serving of tomatoes per day, which is roughly 1 medium-sized tomato or a cup of cherry tomatoes. Keep in mind that tomatoes are naturally acidic, so if you have acid reflux or a sensitive stomach, you might want to start with smaller portions. 6. Beets. When you consume beets, your body converts the nitrates into nitric oxide, a molecule that relaxes and widens blood vessels. This process, called vasodilation, reduces blood pressure by allowing blood to flow more easily through the arteries. Lower blood pressure means less strain on the heart, which is critical for reducing the risk of artery damage and plaque buildup. Over time, the benefits of beets nitrates might help keep your arteries flexible and improve overall circulation, directly supporting a healthy heart. Another heart-protective compound in beets is betalain, a unique antioxidant that gives beets their deep red color. Betalains have anti-inflammatory properties that protect artery walls from oxidative stress and inflammation. This antioxidant effect helps prevent atherosclerosis, lowering the risk of heart attack. A PubMed study found that betalains, especially beta-cyanins, reduce inflammation in cells. This suggests beta-cyanins have both anti-inflammatory and antioxidant effects. To make the most of these benefits, try to include half a cup to 1 cup of beets in your diet a few times a week. Drinking beet juice is also a great option, as it provides a concentrated dose of nitrates. However, keep in mind that beets contain natural sugars, so if you're managing blood sugar levels, it's best to consume them in moderation. 7. Carrots. When you eat carrots, your body converts beta-carotene into vitamin A, which helps protect cells from oxidative damage caused by free radicals. Free radicals may weaken the walls of your arteries, making them more vulnerable to plaque buildup over time. By preventing this damage, beta-carotene helps keep your arteries flexible and resilient, reducing the chances of a blockage that could lead to a heart attack. A PubMed meta-analysis found that beta-carotene supplements may slightly increase cardiovascular disease risk and mortality, especially in smokers. This suggests beta-carotene supplements may be harmful to heart health, and more research is needed on safe intake levels. The second major heart-boosting element in carrots is fiber. Carrots are rich in dietary fiber, which has a big impact on cholesterol levels. Fiber binds with cholesterol in the digestive system, helping your body remove it before it enters the bloodstream. By reducing LDL, or bad cholesterol, fiber helps prevent plaque buildup in the arteries, keeping them clear and supporting smooth blood flow. To enjoy the benefits of carrots, aim for a daily serving of about 1 cup, which is roughly 1 large carrot or a handful of baby carrots. While carrots are generally safe to eat in any amount, consuming too many may lead to a slight yellowing of the skin due to the high beta-carotene content. This is harmless and usually goes away with a balanced diet. 8. Bell peppers. Bell peppers are particularly beneficial due to their high vitamin C content and powerful antioxidants like beta-carotene. This vitamin is essential for maintaining the health and elasticity of your blood vessels. Vitamin C works by stimulating the production of collagen, a protein that strengthens the walls of your arteries, keeping them flexible and resilient. This elasticity is vital for healthy blood flow, as it allows your blood vessels to handle fluctuations in blood pressure without damage. A molecular science review suggests vitamin C may benefit heart health by reducing LDL oxidation and possibly improving lipid profiles and artery function, especially in those with low vitamin C levels. Furthermore, beta-carotene in bell pepper is a carotenoid and powerful antioxidant that your body converts to vitamin A. It helps reduce oxidative stress, which is linked to inflammation and hardening of the arteries, known as atherosclerosis. By reducing oxidative stress, beta-carotene helps prevent plaque from forming along the artery walls. This keeps your arteries clear, reduces blood pressure, and allows blood to flow freely, decreasing the risk of clots that could lead to a heart attack. For a heart-healthy boost, aim to include half a cup to 1 cup of bell peppers in your meals each day. However, for people with a sensitivity to nightshades, such as those with certain autoimmune conditions, bell peppers may cause mild digestive discomfort or inflammation. 9. Cabbage. Cabbage is high in dietary fiber. A ResearchGate review found that high-fiber diets help lower LDL cholesterol and increase HDL. Moreover, potassium in cabbage plays a crucial role in promoting heart health by helping to regulate blood pressure, one of the most important factors in cardiovascular well-being. Potassium acts as a natural counterbalance to sodium in the body, helping to flush out excess sodium through urine. When sodium levels are too high, it may lead to water retention, which increases blood volume and consequently blood pressure. High blood pressure, or hypertension, puts strain on artery walls in the heart, increasing the risk of heart attacks, strokes, and other cardiovascular issues. Potassium works by relaxing blood vessel walls, which also helps to ease blood flow and reduce overall blood pressure. This is especially beneficial in maintaining the flexibility and health of the arteries, preventing them from hardening over time, a condition known as atherosclerosis. By keeping blood pressure at healthier levels, potassium helps reduce stress on the cardiovascular system, contributing to the prevention of heart disease and other blood pressure-related complications. For heart health, Try to incorporate about 1 cup of cabbage into your meals a few times a week, whether in salads, soups, or stir-fries. However, cabbage may cause bloating or gas in some people due to its fiber content, especially if eaten in large quantities or raw. Start with smaller portions if you're not used to high-fiber foods. 10. Brussels sprouts. Brussels sprouts are a fantastic vegetable for anyone looking to boost heart health and keep their arteries clear. Brussels sprouts are rich in antioxidants, such as camphorol, which may help reduce inflammation in the cardiovascular system. Chronic inflammation is a risk factor for heart disease, as it may damage blood vessels and lead to plaque buildup. The antioxidants in Brussels sprouts work to neutralize harmful free radicals, reducing oxidative stress and supporting overall heart health. However, a PubMed study involving over 200,000 U.S. adults found a slight increase in coronary heart disease risk associated with higher intake of glucosinolates and phytochemicals in cruciferous vegetables. Aiming for about a half cup to 1 cup of Brussels sprouts a few times a week is an excellent way to enjoy these heart benefits. Just keep in mind that, like other cruciferous vegetables, Brussels sprouts may cause bloating in some people due to their fiber and sulfur compounds, so it's best to start with moderate portions. Moving on, let's discuss the 5 surprising vegetables that may affect heart health. Even though vegetables are generally good for you, some may have unintended effects when consumed in excess, especially for those with specific heart conditions. Here are 5 vegetables that may impact cardiovascular health if eaten frequently. 1. Eggplant. Eggplant is often cooked in oils or fried, which may add unhealthy fats to the diet. When consumed this way frequently, eggplant dishes may contribute to high cholesterol and arterial buildup. Opting for baking or grilling eggplant may help reduce these potential heart-related risks. 2. Sweet corn. Corn is often consumed in forms high in salt or oils, like popcorn or fried corn dishes, increasing sodium intake, which may elevate blood pressure. While corn is rich in fiber and antioxidants, its high glycemic index may also raise blood sugar, indirectly affecting heart health when eaten in large amounts. 3. Radishes. Radishes contain compounds called goitrogens, which may impact thyroid function in large quantities, indirectly affecting heart rate and blood pressure. Although radishes are generally healthy, those with thyroid issues or heart concerns should enjoy them in moderation. 4. Parsnips. Parsnips have a relatively high sugar content for a vegetable, which may impact blood sugar levels when consumed in excess. Higher blood sugar may stress the cardiovascular system over time, so people with insulin resistance or heart health concerns should enjoy parsnips occasionally rather than daily. 5. Artichokes. While artichokes are high in fiber and antioxidants, they also contain a good amount of sodium, especially when canned or preserved. High sodium intake may elevate blood pressure and increase cardiovascular strain, so fresh or lightly seasoned artichokes are a better choice for heart health. It's amazing to think that what you eat every day may help keep your arteries clear and reduce the risk of heart attack. Remember, adding more of these nutrient-packed veggies to your meals doesn't have to be complicated. Small changes may make a big difference over time. If you're inspired to make some heart-healthy changes, try experimenting with a few of these veggies in your favorite recipes. And don't forget, while these foods may be incredibly beneficial, they're just one piece of the puzzle. Combine a balanced diet with regular exercise, manage your stress, and check in with your healthcare provider for a comprehensive approach to heart health. Now that we have discussed the many vegetables that clean your arteries and prevent heart attacks, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss related videos. Shall we? Watch lose weight with these 10 foods. You may also try our video on 16 quick but strange weight loss tips you may use. Go ahead, click one, or better yet, watch both and learn more about weight loss and nutrition. What other vegetables do you know support heart health? Let us know in the comments below.